Hey everyone, I'm Olivia. I am the second year oral pathology resident, and I am going to briefly go over what a week in the life of an oral pathology resident at Pitt is like. So you'll always follow one of three schedules. You're one of three places all the time. You're either at the dental school and you are on biopsy service, you're at the dental school and you're not on biopsy service, or you're on rotation. Your schedule is the most flexible when you're at the dental school and you're not on biopsy service. Anytime you're at the dental school, the hours are almost always 8 to 4. Occasionally you stay a little later than that, but rarely. Um, the things that structure your day when you're not on service, you're expected to be available for consults within the dental school from 11 to 12 and then 3 to 4. So we encourage dental students and other residents throughout the dental school to schedule the pathology consults in that window. The exceptions to that will be the pediatrics department and the special needs department. They generally kind of need you to drop everything and go see the patient immediately. Other than that, your time is generally spent not on rotation, catching up on other things, specifically studying. So either studying from textbooks, or we have a huge slide library in the residence room that you can quiz yourself on slides. You can also use that time to do research, to meet with any attendings if you're working on a poster for a conference or you're working on a paper, anything that you need to catch up on. Being not on biopsy service is a little bit like study hall. So you get the things done that you don't always have time to do when you're on service or on rotation. When you are on service, your time is much more structured because it's your job to keep the biopsy service running. So you'll go get the slides from the hospital in the morning, you will preview them, you'll write up what your differential diagnoses would be, what stains you recommend, and any questions that you might want to ask the attending about any of the slides, and to prepare those cases for sign out with the attending, which can happen anytime in the day. It obviously varies on when the attending is free when we get the slides from the hospital. You are also responsible for grossing, which is taking the specimens out of the bottle, measuring them, writing a description of them, and getting the clinical histories ready. So the clinicians will provide a history of the lesion and you'll write those into the report, and you're responsible for getting all of those reports ready and then taking these specimens across the street to be processed into slides for the next day. So you're hustling when you're on service. Your days have much more structure to them. Any downtime that you have can obviously be spent studying. When you are on rotation, your schedule is dependent on whatever rotation that you're on. So you are essentially a guest in their home, and they'll give you guidelines on when to show up, and what your duties will be while you're on that service. It can vary quite a bit based on the attending that's on service, what service you're on, and what year you are in your training. So they'll expect a little more out of you in your third year versus your first year. So yeah, you're a guest in their home, so you'll come whenever they recommend. Sometimes it's a little bit longer than the hours at the dental school. Like ENT rotation is usually 7:30 to 5, and sometimes it can be a little shorter. And again, that's very attending dependent. And all this is subject to change, but that's a general guideline of what a week in the life of a oral path resident is like.